Hello and welcome to Learning Unit number 11. Please make sure that you look at the dates that this learning module is associated with because it will be extended out based according to our Easter break. So it's longer than usual, but it is inclusive of our break. So just check out the dates and you'll know when things are due for this learning module. So this is a module on pain and symptom management at end of life. And we're going to focus on palliative sedation. And some of you may never have heard that, and others have, but we're going to look at what palliative sedation is. And we're also going to look at basic skills for conversations about end-of-life care. So at the end of this learning unit, you're going to be able to determine the elements of the nursing process as it relates to caring for clients experiencing unrelenting pain at end of life. We're going to be able to discuss the use of palliative sedation and how it applies to specific client care at end of life, specific clients as we care for them at end of life, and demonstrate the skills needed to assure that ethical principles of respect and for autonomy and dignity, beneficence, veracity, and non-malfeasance are maintained. Those are all ethical principles that we have gone over. Autonomy, dignity, beneficence, to do good, veracity, truth-telling, and non-malfeasance, doing no harm. So when we communicate, we still have to be respectful on these aspects, these ethical principles, especially with patients who are nearing or who are at end of life. So you're going to do a few things. The first thing, you're going to read the holistic palliative nurses, hospice and palliative nurses association. So it's Hospice and Palliative Nursing Association. They have a position statement on palliative sedation. So you're going to read that. It's 6 pages, and you don't have any other reading assignments for this week out of your text. So that's one of your readings. You're going to have a quiz based on that reading. You're going to read the article. You're not going to be going back onto this website, so I'm going to take that one off. You're going to read the article on pain and symptom management at end of life and complete quiz 11. Then you're going to go on to completing an IHI module. This is PFC 202, having the conversation. And you're going to upload your certificate or your screenshot of your certificate, and then you're going to complete the discussion board. Before you do that, you're going to experience a humming meditation. So let's go through. So here is where you're going to access, and it's just that position statement on palliative sedation. So you're going to learn about palliative sedation by going through this position statement. You're going to take quiz 11, which tests your knowledge on that reading. You're going to read another article, and these are the CINAHL articles that are really helpful. There's a lot of bullet points, but it's going to be on managing symptoms at end of life is the title. Then you're going to experience a 7-minute humming meditation, and this is by one of our own MSN students. So as you may or may not know, we have Masters in Nursing and Integrative Nursing Leadership. And it is a fully online program, and it is for BSN prepared nurses, and you can complete it in 1 year or full-time or 2 years part-time. And this is one of our current students, Sarah Winogle, and she had put together this humming meditation and also had an article published in the Meditation magazine. So experience it and then share your experience on the discussion board. So here is the IHI Open School module that you're completing. It's PF C202. Now, there's also a PS, Patient Safety 202, but think, oh no, I want to do the one about end of life conversation, PFC 202. Upload it to the Dropbox, and for week 11 discussion board, there's 2 parts. Summarize the information that you learned by reading the article, Managing Symptoms at End of Life, and then share your experience with the humming meditation. It's not going to be a heavy, intense week, and it is going to be a longer week, but we're also going to celebrate a bit of a break, our Easter break at Mercyhurst University. So that's the end of this learning unit, and I hope you have a beautiful and wonderful week and enjoy time with family if at all possible. Take care and be talking with you soon.